Hello and welcome. If you've been here with us all day, welcome back. We have been doing this since 7 a.m. Central Time, and I hope you guys have all been able to hang in with us. So we are on the back side of it now. We're rolling towards the end, but I really appreciate everybody being here and being able to come on board. And I'm very happy today to have Andrea Rollison with Haddenham here, and I actually said it right. It's not Haddenham, it's Haddenham, and so which is it's actually pretty easy for southern Tennessean to get that Haddenham out, much like the British, so but Andrea, she after earning her degrees in English writing and French language, Andrea moved south to pursue graduate work in behavioral therapy, focus on school counseling, and during that time she began her journey in health and medical as a bilingual in French customer service specialist for Essity. Her passion for education and counseling found its perfect match as her role ultimately evolved to medical advisor, primarily specializing in garments for lymphedema. And after nearly 8 years of working with a variety of compression garments, a variety of clinicians, and a variety of patients, Andrea embraced the opportunity to join Haddenham as operations manager. And she has spent the last 2 years launching Haddenham's compression garments in the USA market and looks forward to strengthening support in the lymphedema and wound care industries. And I can say that I have worked with Andrea while she was with Essity and also now, obviously, with Haddenham. And it's an absolute pleasure to be able to work with her. She is a valuable resource. And what she's done launching this new product, I mean, honestly, it's kind of taken the industry by storm. And so I'm excited for everybody to get to hear what she has to say. But without me stealing your thunder and taking up all the time, I will be quiet. And without further ado, no, I lied. There is a little bit of ado left. Two things. One, I posted a link for the Compression Care Big Day of Training resources page in the comments. I will post it again towards the end. That is where you can go to find all the little cheat sheets and stuff that Andrea has given me. It's also where you can go to get your certificate for attending the course. So feel free to use that link. And then also, for those of you who have not been with us all day, we are hosting an all day Teams meeting. It's a lounge for everybody to go over to. That is the second link I posted in the chat. So if you click there, my team has been jumping in and out of there. Different team members are there. You can meet. If you're using us already, it's a place where you can go and actually put a face with the people you've probably been emailing with anyway. But it's also a place where you can go and get extra questions answered. And I think it'll be a good time to go over there and hang out between the sessions if you have a few minutes there. But now, thank you, Kathy, for showing up. We definitely appreciate it and making this day what it is. We really do appreciate that. And now, without further ado, Andrea, please take it away.
All right. Thank you so much. And thank you for having me here today. Thanks to everyone who's joined us in this. It's really exciting. I'm so honored to be a part of it. Um, as Joshua said, my name is Andrea. I'm the operations manager for Haddenham. So today I'm just going to give you a little bit of an intro to the company. We're going to do a product focus on the Comfy Wave, and we'll go through some measuring basics, what the exceptions to those basics are, and then we'll have a little time for questions, hopefully. So, who we are, Haddenham. It's a UK-based company that specializes in the treatment of lymphedema, chronic edema, and wound care. The focus is providing problem-solving solutions, assisting therapists in treating their patients. We definitely have a very patient-forward ethos. And in 2024, we launched the US market. We launched with two main product lines to start. That's the Easy Wrap Velcro compression and the Comfy Wave. So today we're going to talk a little bit more about that Comfy Wave nighttime product line. So it is classified as a nighttime garment. We know that swelling doesn't necessarily stop overnight. So traditional garments, they may not always be the best option for, wearing them to bed. And that's why we developed this Comfy Wave compression. It's soft, It's breathable. It's a gentle compression at night. And then it can also be used in the daytime with the recommendation from your therapist. Of course, it's case by case basis. Always talk to them first. But it is a proprietary low resistance yarn that allows these to be easily donned and doffed. There's a certain stretch to them, and yet it's still going to be containing. And we'll jump a little more into that. So it is a high elastic knit, and that's what helps it be easy to don and doff. It's made from soft, undyed cotton, which means we try to make sure it's as hypoallergenic as possible and has a maximum comfort. It's breathable. There is a certain weave patterning that we use to enhance the air permeability to keep it as a cooler garment because no one wants to be hot when they're sleeping. So a little bit more about the technology. It is a class 1, 15 to 21 compression level. There is built-in ridges and channels to manage those edema fluctuations. So kind of get those stimulated pressure differentials the way you would with a chip foam garment, but without the chip foam. And it has the high elastic yarns I mentioned earlier to ease that donning process, but you still get the strong containment. And then a little bit more on the technology. It has a seamless knitting, so it's going to reduce the friction and pressure points. And then there's our materials, your cotton, polyurethane, and polyester. That also means that you can machine wash this and dry it. You can put it in your dryer, low to medium heat. That's totally fine. We actually recommend that you put it in about once a month on high heat. Just give it a quick blast. It brings it back to true because the garment really does have some stretch to it. Okay, so here's all the different styles we offer. You have your lower extremity, upper extremity, and then even some torso pieces like your abdominal band, the breast band, and we even have a neck piece. And recently we added the kids line. So with Comfy Wave, you will know what size it is and the length by our color coding system and our dot system. So the color will tell you what size it is. The number of dots will tell you what length it is. So it's really great as a therapist if you have someone walking into your practice saying, I don't know, I have this thing and it doesn't fit, or it's falling off, or it fits just right. If you can pull out our brochure, you can gauge what size it is. You kind of have a starting point, especially if it's a new patient for you. You have a starting point on what their measurements might have looked like at one time or might currently. If you are a fitter and you are with a DME provider, then of course this helps you. If they're a new patient, haven't bought from you before, you know what they've had in the past. So we're going to jump into the measuring. Okay, so with lower extremity, here's the key points to remember. Lower extremity length, you take this laterally. Okay, all of our Comfy Wave garments, they are going to use standard landmark measurement placement. So, B, your ankle, your C, widest calf, G is the groin, and then your length, you're taking that from A to G. If you are very familiar with fitting, then you'll recognize these. If you're not familiar with fitting and you're learning right now, we have these pictures on all of our brochures and our measuring forms. So it's really easy to kind of follow along where you should measure for Comfy Wave. Where it gets a little more nuanced is how you take those measurements and when you size down or don't. And that's really what we're jumping into. So if you are on the cusp of sizes, okay, size down. If the tissue is soft, if it's pitting, if you think there's potential for quick reduction, maybe it's really watery edema that the person has, right? But if the tissue is firm and you don't think there's going to be any reduction, then stay with the size that has more of those measurements in it. So maybe if you're looking between medium and large, you'd stay in the large rather than sizing down to the medium. And then this is just a little before and after, since I'm not focusing on a case study. I just wanted to throw a few glimpses in here. This is a lymphedema patient who went through, a series of surgeries, and the pictures are actually in the reverse. You can see the one where she has the lines. That's the after picture. But the lower leg, each lower leg reduced by 5 centimeters, and the left thigh reduced by 6 centimeters. This patient is currently still in the healing process. Okay, so then we go into your upper extremity measuring. On your upper extremity, this is where it switches for your lengths. You're going to take your length medially. We're still using your standard landmark measurements, your wrist, midpoint of the forearm, your axilla, right? And we're going to take those measurements with tension. Again, if you're on the cusp of sizes, size down unless that tissue is firm. This is one of the garments where we say, well, what are the exceptions? Okay, so the breastband is one of the exceptions. This garment is made with cups. It's great as a standalone garment, and it can also be safely worn under other garments. You can see here, this patient has a prairie bra on over top of her comfy wave. So when you're measuring for the breastband, you want to make sure that you're measuring over a well-fitted bra because you want the over the breast measurement to be very accurate. You don't need to use tension for this product. If you're on the cusp of sizes, don't assume to size down. It depends on what's going on with the patient. You want to use the over the breast measurement as your guide because you want those cups to have enough room to support and give structure to the garment. You want to support the breast tissue, the weight of the tissue. So unlike other garments, we don't always size down. So I'll give you an example. If you have an above breast measurement at 94 centimeters and your over the breast measurement is 115 centimeters and then your below is 87.5. Okay, well, the above at 94 and the below at 87.5 puts you in the medium, but that 115 will put you into that large. And I would tell you that even though the below breast at 87.5 is a little under the range, stick to the large because that over the breast measurement, you want to make sure that there's enough room in the cups for the breast tissue. Okay, so then the comfy wave neck piece. This is another one that is an exception to the measuring with tension and sizing down rule. There's a little bit more assessment that comes with this piece. As you can imagine, you don't want to squeeze too hard and choke anybody. All right, so here we have the measuring guidelines. You want to keep the head level, make sure the patient's not, chinning up, turning to the side. You take the length anterior, and you don't want to assume that you size down if on the cusp of measurements. You really want to assess the likeliness of fluid reduction, skin texture. Patient sensitivity is a big one for head and neck. Okay, so here's some fun pictures that we took. No tension. When they did that measurement on me using the tension, the measurement was 32 centimeters, but the lay measurement was 34. So 2 centimeters can make a big difference. You really want to make sure that you're not squeezing anybody too hard. And then, of course, you don't want to chin up. You want to make sure that the tape is in the right place and that it's not diagonal. And then this slide here, you can see a really nice example of someone who used the garment. This was just within 1 hour of use. It had already started to change the tissue texture. That's why there's the picture of the pinching. You can see how much fluid reduced. So this is someone, I would ask, how sensitive are you? Is there a lot of pain? Seeing that you're going to get a decent amount of reduction, they might be in the medium, but if they're on the cusp between small and medium, if they can tolerate wearing the small is really going to be the fit for them. So a lot of times it can be a case-by-case basis on whether you're using a certain size or sizing down. And if you ever have questions, that's what our team is here for. We're here to help you to answer those questions because we're seeing it every day. So, always reach out and we'll be happy to help you assess on a case-by-case basis.
And on that, just so you know, the question came through. Vanessa would like to know, is there a trach cut out on this garment?
So that's a great question. There is not at the moment. What you see there, there's like a little chin rest, and then you can almost see that the fabric looks a little different where someone might have had a trach. That is because we removed some of those black yarns and we created more stretch in those areas. So it's a little bit more comfortable, but it's not meant to be a cutout. Um, just a little context, Comfy Wave is about 7 years old in terms of existing as a product. So if you think about like your flat knits, your circular knits, and different things, it's really like a baby. So we're doing a lot of product innovation with it. The neck piece, the breast band. There are some others where we have a lot of ideas. There's a lot going on with our research and design, and we hope to keep innovating and adding things like that in the future. Okay, so then we have device combinations. Comfy Wave, it can be worn with a combination of, bandaging, your Velcro wraps, compression bras, pneumatic pumps, non-medical grade compression garments. So just a couple of pro tips if you're going to be doing some combinations. If you're going to use the Comfy Wave underneath a Velcro wrap, because again, it's great as a standalone, but it can also act as a liner. So if you do that, add 3 centimeters to the circumferences for the wrap sizing. Okay, because you want to make sure that the wrap is going to have enough stretch to go over the Comfy Wave garment. If you are overlapping the Comfy Wave glove and sleeve, if your length for the sleeve is right on the cusp and you're like, ooh, short or regular, or maybe it's between regular and long. If you're gonna get that with the glove, you might consider going with the shorter length instead of jumping up to the longer length, because you will have space with the glove as well. And then when you're overlapping Comfy Wave garments, because Comfy Wave does have that unique factor of having a stretch to it, we don't have any suggestions on actually increasing the measurements on the overlaying garment the way we would with the wraps. Right, so Comfy Wave on Comfy Wave, you don't have to change your circumferences. Comfy Wave under a Velcro wrap, change it for the Velcro wrap.
Another question came in here before we move on from that. If the patient is undergoing radiation treatment for cancer, when should you order the neck product? Is it after the completion of radiation?
So that's a great question. That is something I personally would actually pass on to our clinical specialist. So I can get a note of that and get you in touch with our clinical specialist, because there could be more context to that question and it could
Yeah.
change the answer.
Yeah, I've had a couple of different questions like that today where it's almost is and some of them have had to go like, we got to talk to the oncologist before we can really give you an answer to that. But in this particular case, Christy, I'm gonna put you on the list of questions that we need to determine an answer for. And offline we'll get you an answer for that. If anybody is like also interested in that, just shoot me an email and I'll make sure that we get the answer out to everybody as we get it. But yeah, there's probably a lot going into that question, depending on the patient, depending on the situation, how are they handling the radiation, that kind of thing. So, but we will get that addressed for you.
Thank you. All right, so this is just a little recap. Okay, so while Comfy Wave can be used across the continuum of care, it's primarily classified as a nighttime garment with a class 1, 15 to 21 compression level. This can really be thought about in terms of billing, right? It's classified, it is PDAC approved. This is going to be used as a nighttime garment when you think of it in those terms. Yes, it can be used in other phases like decongestion. I've seen a lot of innovation from therapists using these garments at other times. You just want to make sure your patient understands that if they have coverage, what's getting used in that moment is the nighttime. So make sure that they understand how everything looks for their eligibility on garments and whatnot. Okay, so then next point, make sure you're using tension and sizing down when on the cusp of sizes, except when the tissue is firm. For lower extremity garments, take your lateral length. For upper extremity, take your medial length. If you are combining your comfy wave garments with Velcro wraps like the Easy Wrap, add 3 centimeters to the wrap circumferences to accommodate the underlying comfy wave. And then last but not least, the neck piece and the breastband. Those are the two garments. Don't require tension when measuring, and you want to really assess a few other factors before determining if you're sizing down or not. All
Oh,
right.
sorry, we had a couple of questions come in.
Perfect.
Sorry, I started laughing because one of the questions we had, Kendra asked, "Is this billed as a nighttime garment?" And my thought process is absolutely yes. And so but I picked up my phone anyway to verify, and the person I was just about to text just answered on here on the text was like, "Yes, we do." So thank you, Claudia, for answering Kendra there. And then I'll let you finish up before I get to this last question, though. I'll let you finish up first before we get into Julie's and Sarah's question.
Oh no, go ahead. We are on the question slide. I am
Oh,
ready.
okay, okay, good, okay. So, both Julie and Sarah have asked, is there a way, I might open up a can of worms here, is there a way for you to send out samples to a clinic?
Oh man, no, I'm just kidding. We do. We do. Yes. If you, there's going to be another slide in here when I get to the end that has a QR code. You can subscribe to our mailing list, and in that, you should be able to say if you're hospital or clinic based. We will reach out to you. We'll know that it was from this webinar session, and then we can reach out and say, you know, what do you do in your clinic? Do you see a general mix? Are you using some sort of specialty? We'll make sure that we can tailor samples to you if you want a more in-depth in service. We do all kinds of things, and it's typically myself or the clinical specialist that you'll hear from.
Awesome, awesome, that's great. Yeah, I will say this, that I will say I had a sample of this garment very early on. I put it on my legs and wore it while I was sitting here working, and I took it off and I had all the lines on my legs. You know, you can tell that it's doing what it's supposed to do. So I took a picture of my leg and sent it to our founder, Pam, and she took one look at my leg and said, "I want that sample immediately." And so now I know that she got a sample for her arm, and she's actually been wearing it as well. This is one of the garments that she wears now. So that which is a testament because Pam does not just take on new things lightly. And she is very clinical. With an RN background, she takes it in. Oh, Claudia just chimed in there too and said she uses it for she use. I'm just going to read it as if I am Claudia. I use it for my arm post mastectomy. So yeah, so there's there's some real life examples straight out of our company, you know, that are using this garment and liking this garment. So I was definitely impressed with it, and it's making an impact across the nation. I really believe this is a great one. So I've been very excited to be able to bill. I'm just really glad that we are able to be one of the people that are actually able to distribute it out and bill for this garment. So it's great. I
Yeah.
appreciate it.
Yeah. It's always great to hear all of that feedback and, being newer with the product line and everything, we always welcome back any feedback, whether it's, I have some ideas. Haddenham is a smaller company. So when you approach with, hey, have you ever thought about doing a neck piece with a cutout? Or what about a breastband with no cups? Things like that. We really do want to hear those ideas from people who are seeing this every day in clinic, people who are getting those questions from the patients. Send them our way because we'll float them up pretty fast. Um, and
So a couple more things that just came in.
yeah,
Julie really wants to learn more. I love Julie to death, so she is, you know, we talk a lot. Julie, I will make sure that we get you connected directly with Andrea so that you can work directly with her. And then Christy asked, has this ever been used with post-op knee replacement?
yes. So
Okay.
It has been, and I can connect you with. So we have our clinical specialist here. We also have one in the UK who oversees the team, the clinical team. All right. So we've seen it used. Oftentimes, it is also in conjunction with one of our wraps because we do have like a knee piece wrap as well. So if there's ever stubborn fluid that's just not moving after so many weeks post-op, right? You need something to help with that.
Mhm.
Oftentimes, there's this combination of products used to help that patient. We probably have a case study or two on it too that I can get over.
Awesome. Yeah. And another from Yolanda, any feedback from women who are hot flashing and use this product?
Yeah, yeah, absolutely. So it's kind of interesting the feedback on, what is a hot garment. A lot of times, we've had women with a variety of things going on, whether it's hot flash, oftentimes it's hormone related. So there's a lot of hormone variation that can lead to hot and then cold. Um, People who have used nighttime compression garments often will tell us that this is their favorite garment. We've had a lot of people come to us just to buy out of pocket because they say, it's very comfortable. They actually sleep well in it. People who have not experienced compression at night, they'll tell us, well, it feels a little hot, but it's all right. It's comfortable. I sleep in it. I get through the night and they're fine. So I think sometimes it kind of depends on what the experience is for that patient too. And I think sometimes that just comes with with the education and the experience of knowing like what's out there. But generally speaking, we get really good feedback on how comfortable it is and that they don't get too hot where they're kicking it off. A lot of times the comment is it's the only garment I haven't kicked off. So
Mm. So, Claudia actually wrote in on that too and said, I do get hot flashes, and sometimes I have to take it off. Sometimes I don't. Like, it just depends on the mood, I guess, is the whatever's happening. So, yeah, for
how
sure.
hot is hot?
And then,
Yeah.
yeah, for sure. You're very welcome, Yolanda. Vanessa asks, is it really easy to get on and off for those with ADL limitations? And I can say this, that I put it on my leg, don't have any limitations, but I put on a lot of different compression and it was really easy, but I'll let Andrea actually answer that question in more detail.
Sure. Yeah. So every garment will have limitations. I would say that the Comfy Wave is one of the easiest, and I have a lot of garment experience. The Comfy Wave is one of the easiest for donning and doffing. Um, that said, will there still be a struggle? Maybe. I've only seen it in terms of I'm actually in operations and I oversee, anything that's coming back in terms of return or exchange. I've only seen it a couple times where someone had to return it because they couldn't get it on. Um, if you're looking into like donning aids, um, I would say anything like any of those silky things, especially arm pieces. Arm pieces tend to be ones that people have more trouble with if you have dexterity in the hand issues and you're trying to get it on. But use something that helps cut that friction to get it on.
Mhm.
But don't use donning gloves because of the yarns being cotton, and you don't want it to rip up any of the threads or the cotton.
Yes, that's good advice, actually. That's really good because I wouldn't have thought of that. So I appreciate that for sure. Um, Kristen asked a question. Could you use the abdominal band as a breast band for patients who are flat or smaller after mastectomy, or is there a breast band without cups in the works? And I think you mentioned that there is one in the works, but you don't have one now. Is that right? But I'll let
Something
you
like
answer
that.
the
Yeah,
abdominal.
yeah,
I'll let
yeah.
I'll let you answer the abdominal band before I start just going
Sure.
ahead and inventing products that you don't sell yet. So,
Yeah, it is a prototype, the breast band without cups. So I'll say that there's a prototype. We don't have a timeline. There's a lot of testing and whatnot that has to go into that. Um,
mm,
but absolutely, it was some of the most overwhelming feedback that we got to make one. So
Man, I can
It's looking
just
good.
I know a lot of people don't see what goes on behind the scenes. One of the companies I worked for in this industry years ago, uh, we would see a product and then like a year and a half later, and we'd all get excited. We're like, "Oh yeah, this is gonna be good." And like a year and a half later, and finally come out. We just, like, we started learning to temper ourselves because it does take a lot. There's a lot of product development, a lot of testing that goes into every single product that's launched. So yeah,
Yeah.
I get that for sure. And sometimes it can take a while, but hopefully, obviously, it'll work. So
Yeah,
we
absolutely. And that's even, something non-medical. You put med grade behind it. It's a whole extra set of things you got to do. So,
yes, it
yeah, there's a
is.
lot to it, but it's definitely in the works. With the abdominal band, I would encourage that person to reach out to me because I actually have a lot to say about that. In summary, I have seen it work. I've also seen the breast band with cups work on someone who has a double mastectomy, and they still found it very comfortable. So there's a few different options. And I also fit a male patient with the abdominal band for the torso. And there's just a couple of changes in how you wear it to make sure it's being as effective as possible. That can come
Okay.
with limitations, like you want someone who has a longer torso since the abdominal band is a bit long. But yeah,
Okay, here's just a piece of advice for Chantel. She says it's maybe unconventional, but she has put the cups in the back and the flat side on the front to help with flatter chest patients, and the patient loved it. So, maybe a way. Another question's come in. I actually seen this twice, and I was gonna save it here right for the end, and here we are at the end. Um, Comfy Wave distribution in Canada, and I know that I saw you up there in Canada not too long ago. But can you speak to that a little bit because we've had several Canadian therapists on these different programs
yeah,
throughout the day. I will say this from a compression care standpoint, we as a company are working on getting into Canada. It is going to be a futuristic thing, and it's not going to be next month. It will be a minute, but we are going to get there. And so we are doing that. But then, how is the distribution working? And can you speak to the Comfy Wave Haddenham side of that?
yeah, absolutely. The original plan was for us to launch there last year, but with everything happening with the tariffs, I did some test shipments, and it's just unrealistic.
Mhm.
Seeing what the patients had to pay just getting it as a sample, I was like, "Oh, I can't do that to people." So we've
Yeah,
had to change
for sure.
tactics. So the it is now in the hands of Haddenham UK, our parent company. They will be looking to work with uh, a distributor in Canada. And at that point, because it's out of my hands, it's really on their timeline. We'd like for it to happen this year. Um, and we know that it's not last year like we were thinking, but hopefully this year.
Yeah. So we just need a distributor in Canada, and there we
Unless
go.
someone
And
can
that's
fix the tariff issue, that'd be
yeah,
great.
and that's yeah, you got to go around that by having the actual distributor there. So you're shipping one shipment in, and they distribute to everybody, and that's kind of what compression care is in the middle of too. Is like we're having to work with. We can't just ship products up because it is virtually impossible now to do that, and so for whatever it's worth, what we would like to do then is basically open Compression Care Canada, and that would also be Compression Guru Canada. And I know I'm giving a lot away here, but yes, you know we have to at some point do that. So it's going to be an exciting time, but bear with us. We're going to get there, we promise. So
That would be
and
awesome.
yeah, it'll be fun. And so I just want to say, because I know we're having to wrap up here, but for everybody that has been with us all day, or even if you're just jumping in, thank you so much for being a part of this. It really makes it worth it for us to have y'all jump in and ask these questions and be a part of this entire big day of training. And Andrea, thank you so much also
Yeah.
for being part of this and coming on and giving up your time to talk about this. And I think it's very helpful not only to the therapist, but it trickles right down to how can we help the patients the most? And so
Absolutely. Yeah,
that's the most important. It's why we're all doing this. You don't stay in this industry unless you want to help patients. So
hundred percent. 100%.
there's always been there's been the jokes, like there's easier ways to make money, but this you got to have the passion and the heart for it here. So we definitely appreciate you being here. I appreciate every single one of the therapists that are here and seeing
Yeah.
this today. And I look forward if you're gonna be on the next one, I will be there as well. But thank you very much. The links to I did repost them, but we've put some more chat in there. But you don't have to scroll too far up. Find the Big Day of Training resources page. Scan her QR code. I know Andrea from that resources page we'll be able to get everything, and then we are going to be sending out emails. Probably going to be tomorrow, maybe even Friday, just depending on how much follow up we have to do. I'll get all that done. Christy, you asked a question that Andrea said you wanted to connect with. I'm going to connect you to via email. Again, it won't be today. I can promise you that, but we will get you two connected. So I did see that and heard it and wrote it down. So got that taken care of. But feel free to jump over into the Teams meeting with my team. They will all be there. It's just the lounge, just a place to go hang out. If you need to, just I don't know, tell a dad joke or something. It'll be fine. So, but I do appreciate every one of you. Thank you so much, and have a great day, Andrea. Thanks again.
Perfect. Thanks so much.
Bye bye.
Bye.